Hello viewers, in this video we are going to discuss about the association between thyroid problem and diabetes. To start with, so most people come with a question that does thyroid problem happen in diabetes? The answer is yes. How exactly is? Diabetes is also of two types, as everyone knows. We do have a type 1 diabetes which occurs right from the childhood, which is mainly because of the deficiency of insulin production, and we do have a type 2 diabetes which occurs mostly in adulthood, which is not due to deficiency of insulin production, but it is because of something called as insulin resistance. So in which group of people does thyroid problem happens is, these thyroid problems are more common in people with type 1 diabetes. Why this thyroid problem is common in type 1 diabetes is, type 1 diabetes, as discussed in other videos, it is mainly an autoimmune disease. What is autoimmune disease? In our body, we do have immunity to fight against foreign body or foreign cells which are attacking on our body. Like if we have any bacterial infection or we have any viral infection, then our immunity acts because against this foreign bacteria. What happens in these autoimmune disorders is, if our immune system acts against our own cells by some mistake, then these are referred to as autoimmune diseases. As we discussed, type 1 diabetes, that is diabetes which occurs right from the childhood, is a kind of autoimmune disease. Just like the way this autoimmune disease is destroying our own insulin producing cells in the pancreas, if the same autoimmune disease affects the thyroid cells, definitely there will be deficiency in production of the thyroid hormone, resulting in hypothyroidism. Whereas this risk is much less in type 2 diabetes, because type 2 diabetes is not an autoimmune disease. So to put it in a way, so these thyroid problems are more common in problem with type 1 diabetes, whereas these are very less common in type 2 diabetes. So what to be done if to detect whether these problems are happening or not? Especially these diagnostic tests, to start with, be it thyroid hormone or the sugar levels, are definitely to be monitored right at the time of childbirth through simple tests for checking their sugars and for their checking their thyroid hormone levels. What if these tests are abnormal? These tests are to be, treatment has to be started then and there itself, because if this thyroid problem is not corrected at the right time, this may result in bit of physical and mental retardation of the baby. So every newborn baby has to undergo this thyroid and sugar screening right before the discharge.